Thank you, everyone. So before the break, Lynn was talking about how artificial intelligence is pervading our everyday lives and if that's a good or bad thing. So I think it's a good thing, having humans in the loop, having artificial intelligence to augment healthcare and find diseases and treat them. So artificial intelligence in healthcare, when I go to the doctor and I hear about my doctor using artificial intelligence, I'd want it to be fair and trustworthy. As Lynn explained about explainability, I'd want the algorithm to know, I'd want to know how the algorithm is thinking. I'd want it to be bias aware and actionable. And I'd also want it to be private and secure so that it doesn't fall in the hands of anyone using it in the wrong way. And most of all, I'd want it to be patient-centered and be about me and my health. So today I'm going to be talking about some of the projects going on within the past year and currently, and highlight the patient-centered, fair, trustworthy, actionable decision support tools that is part of medical AI at Southwest Research. So I'm going to step back and go to the exposome, which is the environment and your lifestyle. So the products and chemicals you use, the air, your water, and your diet and food that you eat is all part of the exposome and how that relates to your healthcare outcomes as well. So this is a project that was an internal research project at Southwest Research called Asclepius. It is a backronym, so hence the long title. But the Asclepius is the Greek god of medicine. And for this project, we're exploring the exposome, and recent studies have showed that around 85% of diseases can be attributed to your environment. So we have been looking at, can we identify harmful compounds within your environment, and can we look at them in your hair? So it turns out you can look at them through your hair and find harmful compounds in your environment. As you've seen in the news, the red dyes are kind of, on the radar for harmful chemicals that can be in your food. And we're looking at unknown unknowns at this point. What is the next new red dye? So we're trying to bring this to the public as a new diagnostic test and fingerprint for individual exposure. Kind of honing in on maternal outcomes, and looking a little bit, stepping into not only the environment around you, but also the environment in the womb and the environment of mothers. So this is a San Antonio Medical Foundation grant that allows nonprofit research and seed funding. We are looking at high maternal mortality rates in the area of San Antonio. There are many differences within zip codes and outcomes that come from those differences. So we're really looking at an explainable model that tries to correlate conditions between good and bad outcomes. So we're looking at before pregnancy, during, and 9 months after to see what levers can we pull and suggest interventions to reduce those risks for mothers and babies in the area of San Antonio and also nationwide. And as you can see, top causes of pregnancy-related deaths in the state of Texas, 22%. Is related to obstetric hemorrhage, and 18.6% is related to mental health conditions. So if we can have, nurses and doctors have suggestions and have a decision support tool for mothers, and so that they can, reduce the risks of having negative outcomes and have a community-based intervention mechanism in place. And going on a more, even more micro scale, we're tracking neuron development as well. This also came out from a San Antonio Medical Foundation grant. We are tracking neuron health using 3D tissue growth to mimic the brain neurons. It's called organoids. So we're tracking neurogenesis. We are tracking new neuron growth over time to look at and evaluate the differences between healthy and unhealthy brain development using computer vision algorithms. So this is an image of neurons, and the highlighted pink are the soma, which is a part of the neurons. And looking at this is a snapshot in time, but looking at a longer time period, we can see the density of the somas changing, and that is one of the indicators of brain health over time. So switching gears a little bit, I was talking more about public health and, the environment, mothers, and this is more military related. So this project, Remedy, risk evaluation and medical decision efficacy, is part of a program here that is funded by the DoD. So really we're enhancing medical military operations for medical military planners. It's a comprehensive software decision support tool that does data fusion and visualization capabilities for troops that are deployed. So let's say, there are troops deployed and there's a new COVID coming up, new and emerging biological and chemical threats. We want the troops to be prepared. Any vaccines that you can take beforehand, any medication that you can take during, and any follow-up treatments afterwards is all encompassed within residual risk scores. And these include FDA-approved investigational and also repurposed drugs for the use of mitigating chemical and biological threat agents. And not only are we looking at remedies with drugs, but we're also looking at total force fitness. So this is a refuel holistic application, a phone application that looks at mental, spiritual, physical, and emotional health. So really we are modernizing military health, and I have a video that kind of speaks to what this project or this application is about. And it is sponsored by the Air Force, and Southwest Research did the back-end development for this. Natural language processing was used, which has been popularized by ChatGPT. And the recommendation engine, as Lynn was talking about, you can experience a recommendation engine with Netflix or Spotify giving you a recommendation for what you need to see next in this context, or what the user or the veteran or the military member would benefit from seeing next, whether it is for their emotional or spiritual well-being. So SwRI was involved heavily in the back end and some of the front end development for total force fitness and helping empowerment of veterans and service members today. So we're going from diagnosis to prognosis, and a little step back from 2019, where we won the Breast Path Q Challenge to detect breast cancer diagnostics with tissue slides. In 2022, we looked at gaze detection and radiologist fatigue. And last year, we touched on mild TBI, which my colleagues will talk about in detail. But this is an EEG image that we are trying to diagnose and prognose for athletes and military members about mild traumatic brain injury and what the prognostics will be from that. So we're going one byte at a time, and our future focus areas are in personalized medicine, keeping the patient at the center of all of the work being done, public and military health, and AI and drug discovery. So this really has been and needs to be in the future a collaboration between AI developers like myself, subject matter experts, healthcare providers, and regulators at the state and federal level. And our future priorities are to keep patients at the center, have a human in-the-loop decision support tool, and see where it goes to have everyday miracles become a reality in the space of medicine. And with that, I will answer any questions that you may have.